My name is Nedim Durmus. I'm working at New York University Medical School. I'm completely going to take you to a different topic, but the main point will be the same at the end, in the conclusion. I'm going to talk about the revolution of healthcare with the artificial intelligence and in clinical practice and medical education. Mainly, I'm working on clinical studies, so I'm interested in on the clinical part. So in recent years, AI has emerged as a transformative force in many fields. Of course, healthcare also has been affected. The integration of AI into the hospitals, clinics represents a paradigm shift in how medical care is delivered and also managed. Here, I would like to talk a little bit about the role of AI in healthcare and also mainly in clinical settings and also management of healthcare. AI algorithms can be broadly categorized into machine learning, deep learning, and natural language processing, each with unique strengths and applications. In the machine learning, the algorithms learn from data to make predictions or decisions without being explicitly programmed for the task. So it is definitely used for the huge bulk of data in clinical settings from the patients. We have many data, mainly the statistics part is wonderful in the healthcare settings in US. And even if you go online, you can download the healthcare statistics by state for all of the US, and you can analyze that. But as it's a really huge data, it's really very hard to analyze. So the machine learning is helping us in this setting. Deep learning is used to neural networks with multiple layers to analyze the complex data structures. And mainly, they can be used in processing imaging data, making them invaluable for diagnosing the diseases from medical images like the X-rays, MRIs, and the CTs. The natural language processing algorithms allow computers to understand and interpret human language. One of the main work of the healthcare professionals are to taking notes of the patients, because whenever you take care of a patient, you have to write down all the history, family history, all the genetic background. And after the visit, you have to write down everything down, like whatever you told, how many time you have spent with the patient, all the lab results and the possible diagnosis and possible next steps you have to write down. It's very, very important. And also there are some structures like EPIC that you share the data between other hospitals and universities. So when the patient goes to another physician or another healthcare center, that they can see the same results. So how has the AI impacted the health industry? Healthcare offers, AI offers in healthcare ability to process and analyze vast amounts of medical data beyond the human capacity. And it can be used in diagnosing different diseases, predicting the outcomes, and also recommending possible treatments. For instance, AI algorithms can analyze medical images, as we have told, with greater accuracy and speed than human radiologists sometimes, often detecting diseases such as cancer at earlier stages. We will talk about it later. The question is, how is AI used in healthcare extends beyond diagnostics? AI applications are also reshaping the patient care management, drug discovery, and healthcare administration. And in patient care, you can have chatbots and virtual health assistants that can provide 24/7 support and monitoring. There are some facts about AI in the healthcare. The global AI in healthcare market is expected to reach $45 billion by 2026 and 188 billion by 2030. The implementation of AI in healthcare reduced around 20% of physician time mainly in the administrative tasks. And AI helped, for example, Moderna, the pharmaceutical company, to optimize its COVID-19 vaccine. And a report from the NCBI study states that AI-based algorithm successfully detected 68% of COVID-19 positive cases in a data set of 25 patients diagnosed as negative cases by healthcare professionals. North America is the the biggest contributor to the AI in the healthcare market with a whopping of 59% of the market share. 90% of hospitals will use AI-powered technology for early diagnosis and remote patient monitoring by 2025. Even like, as I said, I am in NYU. So now the ongoing educations, the internal educations are mainly going on the AI and how to use the AI and like how to mainly protect the patient's data insecure with the HIPAA regulations. So that is the main intra-hospital education webinar series. It's estimated that chatbots driven by AI will have healthcare organizations around 3.6 billion worldwide. And research discoveries may occur considerably more quickly if AI applications are executed on computers with far quicker processing speed than humans. And 23% of healthcare executives in the US, according to a study, believe that AI and machine learning are very effective at improving clinical outcomes. When you look at which medical disciplines are using AI-enabled devices, we see that the radiology is mainly the main discipline that is using the AI because they are most of the mainly all of the images are online right now, and they are assessing the images. Of course, they have to. The radiology is not only looking at the images like the X-rays, the MRIs, and other things. They have to take into account the patient's family history and also the clinical outcomes and the lab outcomes. But still, in the radiology, it's used a lot. In the second place, there is the cardiovascular disciplines are using the AI-enabled devices. When we look at the case studies of AI in detecting the diseases, we see that the diagnosis of diseases such as cancer, diabetes, and other critical conditions have been demonstrated in various case studies. In cancer detection, there's a study published in Nature, and they have reported a development of an AI model by Google Health. This model was trained on a large data set of mammograms and demonstrated that the ability to detect breast cancer more accurately than human radiologists. Breast cancer is the most seen cancer in women, especially after the age of 45. The AI system showed a reduction in both false positives and false negatives, key factors in cancer diagnostics. So, the early detection of any type of cancer is very important. So it brings a really good advantage in the cancer management. Another area is the diabetes management. For the diabetes, the most bad part of the diabetes is not the disease itself, but its complications. So we have to always try to manage the complications of the diabetes. So the AI is mainly used in the managing and detecting diabetes by using several mainly wearable devices, and also particularly through machine learning algorithms to improve and to detect the complication of diabetes in early stage. The other one is heart disease prediction. The prediction of heart disease using AI represents a significant advancement in any cardiovascular disease. This is not only attempts to determine its severity and also to treat it on time, to manage it, and also to prevent it. In neurological disorders, the deep learning in neurology has opened new avenues for diagnosis and management of the neurological disorders. Mainly, the studies have been focused on the Alzheimer's disease because Alzheimer's disease is one of the most severe neurological disorder. Unfortunately, the number of the percentage of the patients who are having Alzheimer's is increasing by the time, and we don't have any effective treatment method right now for the Alzheimer's disease. So it will be very important to early detection and also accurate diagnosis of various conditions in Alzheimer's disease, and using the AI in assessing the neuroimaging studies and to detect the disease earlier. So there are some kind of drugs that we can use, and we can make it like slower and better, or we don't actually, I cannot say prevent, but at least to increase the quality of life. And in personal medicine, it's an increasing area. It's very important because the drugs, when they are developed, the drugs are developed for regular population. When there are clinical studies to develop the drugs, we have a regular population. There are inclusion and exclusion criteria. So that means that we have investigated that drug according to a regular population. But when we go into the population, the regular population is not regular. They are different. Some people are thin, some people are fat, some people are smoking, some not, some are drinking, some not, and many differences. So we are having some adverse effects when we don't see in the clinical studies while investigating the drug, but when it's marketed. So the personal medicine is very important to use the right drug for the right person with the right dose and also with the right cost. So the advent of AI in healthcare has boosted the growth of the personalized medicine to use the correct medicine for the correct person. And also the predictive analytics in drug development, we use the drugs. First of all, we do in vitro studies. That means that we don't use any live animals or human to test the drug. First of all, we use in vitro and in silico methods. Then we go in and using the experimental elements, and then we go into the human. So we, of course, when we use in the in vitro studies, and also when we do in silico and in animal studies and in human studies, we have a lot of data. So the AI can predict and make a good prediction for the drug development and the possible adverse effects and possible effects of the drug. And in mental health, the mental health problems are increasing rapidly, unfortunately, but by monitoring the patterns in speech, behavior, and social media activity of the people, AI tools can help in identifying the onset of mental health issues and suggest interventions tailored to the individual's unique situation. We are having some, different attacks, terrorist attacks, and other things for someone living in the society. We don't know, but after the incident happens, then they say that, oh, he shared a post on Facebook, he shared a post on Instagram like this and other things, and he was behaving like this, she was behaving like this. So these kind of algorithms may help to detect the mental health problems beforehand. So these case studies, the time doesn't allow us to go in more, but we can increase the number of these ones. So these case studies highlight the AI's significant role in advancing disease detection across multiple medical disciplines, offering accurate and timely diagnosis, often through non-invasive methods. And also AI can be used in hospital operations management, medical imaging, diagnosis, we talked about it, patient care and monitoring, AI-powered wearable devices for continuous monitoring for people who has chronic diseases or who has genetic background, and virtual nursing assistants powered by AI and AI in telemedicine remote patient engagement. But of course, there are some ethical considerations and challenges. AI continues to enhance the healthcare sector. It brings significant ethical considerations and challenges. While the AI technology continues to evolve, there is a critical need for addressing challenges such as the data privacy. It's very important. In the hospital settings, they are using different studios, like not online AI studios, but for example, our university has its own AI-powered tools. You can use whatever tool you can, but you have to go online and you have to with your own password, and it's secured and HIPAA regulated. You can do any analysis and other things. You can upload patient data and other things. Algorithmic transparency and also ensuring equitable access to these technologies. So conclusions. Including the clinical decision-making, hospital operations, medical imaging, diagnostics, and patient care through wearable technology and virtual assistants, AI has showcased its transformative impact in healthcare. By enabling enhanced diagnostic accuracy, facilitating the personalized treatments, and optimizing operational efficacy, AI holds promise for reshaping the healthcare landscape. AI holds immense potential for personalized medicine, advanced drug discovery, and addressing global health crises. By leveraging AI technology, healthcare delivery can become more efficient, data-driven, and patient-centric. Realizing this potential requires a concerted effort from various stakeholders, not only the healthcare workers and also technology developers, healthcare providers, policymakers, and also the patients. However, alongside these advancements, AI implementation in healthcare also raises important ethical considerations. Future developments should focus on creating more robust AI systems that can handle diverse data sets, thereby reducing the potential biases in diagnosis. The greatest challenge to AI in this healthcare domain is not whether the technology will be capable enough to be useful, but rather ensuring their adoption in daily clinical practice, because the people should also adapt to it. For this adoption, AI systems must be approved by regulators, standardized to a sufficient degree, and also taught to clinicians, the healthcare providers, paid for by public or private payer organizations, and updated over time in the field. It also seems increasingly clear that AI systems will not replace human clinicians on a large scale, at least for now, but rather will augment their efforts to care for patients. Over the time, human clinicians may move toward tasks and job designs that draw on uniquely human skills like empathy, persuasion, and big picture integration. Perhaps the only healthcare providers who will lose their jobs over time may be those who refuse to work alongside the artificial intelligence. Finally, gaining acceptance and trust from medical providers is critical for successful adoption of AI in healthcare. Healthcare providers need to feel confident that AI systems is providing reliable advice and will not lead them astray. This means that transparency is essential, and compliance with federal and the governmental regulations is very important. Integrating AI with traditional diagnostic methods and enhanced interdisciplinary collaboration is important. And then, coming to the main topic of the conference, all these pros and cons about the AI in healthcare brings in the importance of that AI should be included in the education of all healthcare professionals, and they should be informed about AI throughout their education. This is the end of my slides. If there are any questions or comments, I'll be happy to answer.
Thank you so much. Very eye-opening with all of the different applications. What is how receptive is management, administrative leadership? Are they proactively allocating budgets towards this? That's one. Second is the vendors who are providing these software technologies. What does the lead time look like to integrate something like this? Because I imagine healthcare, long-standing organizations, they have certain ways of doing things. They put out RFPs and get quotes. But I imagine AI vendors are smaller, agile organizations. Are they willing to embrace? I almost see it. You know what I'm going to
Yeah,
I see a difference in ideology and the way in which people work. Healthcare sector, and then the newer vendors for providing these kind of services.
Yeah, very good question. So I definitely see, from my perspective, what I see is the administrative people in the healthcare settings are very aware of this. They are trying to adapt the AI as soon as possible. Maybe they think that they can reduce the number of people they are paying for. I don't know. And secondly, the AI tools, they also really adapt to healthcare settings. I see that they are providing us we are using different ones. Like the first, in the first presentation, Dr. Orhan listed some AI tools. None of them are only maybe one of them is used in the AI settings. They have different names. They are just working on the healthcare settings. So our AI studio, we have several tools. Their names are completely different. They are completely adapted and developed for the healthcare settings. So there are some companies just working on the healthcare settings. Maybe these the first and the other companies, the AI tools may adapt by the time, but we can definitely see that some companies just focus on the healthcare settings.
You had a graphic, a pie chart saying that the AI is used in the healthcare in these domains, neurology, imaging, and so on. But I couldn't see that mental health part. I think it is one of the lesser studied area. What can be the reason behind? Is image processing is somehow easier in this?
Yeah, you have something in hand, and there the imagings are all, as I said, they are online. So and when you look at the images, you put in there are some images when you see some specifics in the images and you go to some diagnosis, and the imaging radiology area does not, they do not directly make a diagnosis, they just make suggestions. So they suggest that this may be this. They cannot say the direct diagnosis. They always send and then every radiology report finish with that, according to our findings, this may be this, but the clinician should go over the clinic results and other things, and they should assess everything, blah, blah. So I think as radiology is easier to adapt to the AI, the others, by the time it will change, I definitely believe that the others ones also will start using AI more by the time.